Sleep apnea is a disease where people snore and stop breathing in their sleep. It's pretty common. All right, we estimate about 1/3 of the adult population probably suffers from this. The problem is the people that have it don't know they have it. So it often does not get diagnosed. In fact, probably only about 5% of the adult population has been diagnosed. Sleep apnea is a situation that you inherit. Okay, this is literally how you're built from the neck up. Everyone blames weight. Weight's not the cause. Weight makes it worse, aging makes it worse. But quite simply, this is how you're built from the neck up. And by the way, there's a lot of anatomical factors that go into that. We can't just pinpoint one reason why people have sleep apnea. But some people are simply built in a way where the back of the throat down here actually just gets narrow when they sleep. That's what snoring is. That's air moving through a narrow space. Snoring's not the issue. As long as the air is moving, we don't care what it sounds like. The problem is throughout the night, the back of the throat will collapse. It kind of sucks itself shut. That's the apnea, where you stop breathing. This can go on all night long, hundreds of times. The patient will be completely unaware. Now, fortunately, even though the brain's asleep, it's also monitoring us for oxygen levels and breathing. And when it senses that we stop breathing for a period of time, it sends a signal, tells the throat to open again. All right, people don't die in their sleep from sleep apnea directly. Okay, so why do we care? Right? As long as the brain's on the job, we're not going to die in our sleep. Why do we care? There's two reasons. First one's quality of sleep. If your brain has to police the back of your throat all night, it doesn't get through the sleep stages very well. You sleep, but it's mostly the lighter stages. You're not getting as much of the deep sleep and the REM sleep, the rapid eye movement sleep, where we get rested. So these people sleep all they want. They wake up, they're sleep deprived. And the problem is most of them don't know it. That's all they know. And sleep deprivation affects everything. Memory, concentration, mood, sex life, energy level, motivation. Sleep deprivation causes more car accidents than alcohol. We have a lot of legislation that, comes down hard on people who drive drunk from alcohol. But you can drive sleep drunk anytime you want. And it's really important that people are aware of this because it's very dangerous. So there's certainly a quality of life component to sleep apnea. The second problem with sleep apnea are the physical consequences, particularly with the heart. Every time that throat closes, it's going to open again. But before it does, there's a period where you weren't breathing. Your oxygen level drops, heart starts racing, adrenaline's released. It's like putting your heart and your body through a stress test every night while you sleep. Over time, this causes heart disease, high blood pressure, heart attacks, strokes, heart failure. Sleep apnea is a direct cause of heart disease. Sleep apnea also contributes to other diseases. It contributes directly to diabetes. All that stress, all that adrenaline release kicks up the sugars. Contributes to erectile dysfunction in men. Contributes to dementia. And now the latest research suggests that it contributes to cancer. All right, bottom line, people with sleep apnea who aren't treated don't live as long as those who are. Just like people with high blood pressure who aren't treated don't live as long as those who are. So clearly there's a lot at stake with sleep apnea, not only from a quality of life standpoint, from an overall health standpoint. So it's real important to get the word out and we screen people who are at risk.